Hey there guys, it's Dr. George here coming on with my doctor's hat on. And today I want to respond to a question that was given to me by Seth on Facebook. Thank you for the question. And it was really about coming out kinky to your doctor and how much do doctors need to know and is it important and things like that. So it's an interesting question because unfortunately a lot of people who are within the kink scene have had bad experiences with doctors, and this is very, very unfortunate because it means that people are less likely to come and see a doctor after that, and that really means that these people are missing out on the opportunity of having a good health screening. So what do doctors really need to know? When it comes down to it, what I need to know as a doctor is not in particular what your kinks are. What is helpful for me, say for example with a sexual health screening, is that I need to know what you do with your body. I basically need to know, do you sleep with men, women, or sometimes both? That's important to know because it changes what testing needs to get done, and whether or not you've had fingers, toys, anything inside your butt, anything inside your mouth. So that will really help make a big difference for sexual health screening. How you do it, if you're hanging from the chandeliers, I don't particularly care. As long as you don't break your neck falling down, I don't care. I just want to make sure that you get the proper screening that you so rightly deserve. Now, being from a kink family and from the kink side of the room also means that you are at risk of other things as well. Say, for example, I've just come back from a huge HIV conference in Adelaide and it was amazing. But we now know that gay men are at significantly higher risk of anal cancers. We're talking 20 to 40 times the risk if you are HIV negative and 100 times the risk if you are HIV positive. And to put that in perspective, that is higher risk than breast cancer, prostate cancer, lung cancer. And we're not telling people this. So if I know that a patient is gay, identifies as gay, then that's really, really important. If I have patients who identify as trans, it's really good for me to know because it means that I can address you as you wish to be addressed, and so you should rightly be addressed. And these are important issues for me as a doctor, that I make sure that I want to offer you the best care possible and the most comprehensive care possible. But it's about comfort. And this is where I'm working really, really hard, is that I do everything I can to make my patients feel comfortable and safe. And what I would put to you is that it's important that you keep on looking for a doctor that makes you comfortable and safe to be able to have these conversations, because when you have that level of safety, it means that you can be open and honest with your doctor, and that enables us to ensure that you are getting the care that you so rightly deserve and that nothing is missed. So my impression is that if you're looking for a kink-friendly doctor, one thing that you can do is ask your friends. Ask your friends, is your GP kink-friendly? Are they respectful for you and the way that you live your life? And if the answer is no, then swerve and go and find somebody else. Keep on searching. If that's not really lucking out for you, then the next step would be to go to, say, a gay men's health clinic, because they're more likely to be less dreary. They understand stigma and they know how to avoid it. So that can be a good choice. And if that's not possible, then the local sexual health clinic, they will know good doctors. They will know good primary care physicians who are able to refer you. So I kind of hope that that's kind of answered the question, but to be honest, I don't particularly care about a person's kink. What I do care about is their risks, and the risks are what we are going to be testing for when it comes to sexual health, but also things like risks of substance misuse, like use of methamphetamines. We know that that's a significantly high risk of developing HIV, but also depression, anxiety as well. So, I think the key point is that a doctor doesn't necessarily have to be into a kink, but they have to be open, honest, and allow you to be open and honest as well. I hope that kind of answers the question, Seth. But at least I hope it opens a conversation that we can all talk about that. No matter what your kink is, you deserve good healthcare. and I will fight tooth and nails to ensure all of my patients get that. Have a great day.